is a multidisciplinary approach for men diagnosed at all stages of prostate cancer?
So it depends on the type of disease. So if a patient comes in with metastatic prostate cancer, that multidisciplinary approach has a different slant because the most important element is going to be controlling the metastatic disease. When patients present, and then you get into the androgen deprivation therapy and or other systemic therapy that might take the lead or be the quarterback in the approach. And then following the control of the disease with systemic therapy, consolidation is then discussed, which may reflect something around surgery or radiation or surgery and radiation. So it could have impact in terms of the sequencing. So if a patient comes in with early stage disease, radiation or surgery are typically the modalities. And for very early stage prostate cancer, active surveillance. And systemic therapy is not as much the major consideration. And then as we move up on the scale of localized disease, but localized disease with higher risk, then we add in the systemic therapy, especially with radiation, in conjunction with the treatment. And plus or minus, well, surgery may be an avenue patients choose, or they might choose radiation alone. So that's why in the discussion, the stage of the disease makes a big difference in terms of sequencing and what type of treatment, and whether it's localized or metastatic. All of these go into the decision-making process, and that is part of the workup and discussion that we have to identify the optimal therapy and the optimal sequence of that therapy for an individual patient.